Hello, my name is Sam Schoenfeld and I'm a third-year medical student. Listed are my fellow colleagues who I'd like to thank for their contribution to this project. This is a presentation on the incidence of secondary overtriage in trauma patients during the COVID-19 pandemic. I have nothing to disclose. So Level 1 trauma centers are the comprehensive hospitals that can provide full spectrum care to patients and play a vital role in the local and regional healthcare systems. Grant Medical Center admits patients transferred from a large swath of rural Ohio where no verified trauma centers exist. Common reasons for these transfers included subspecialty consultation, specifically neurosurgery, orthopedic surgery, and plastic surgery. The pandemic certainly provided many strains to the healthcare system, and over-triaging trauma patients didn't escape this wake either. After reviewing the literature regarding secondary over-triage, there is small variation in how it's defined, but most definitions include length of stay less than 48 hours, low injury severity score, no need for major surgical intervention, and no need for critical care. We define it within our study as patients transferred to Grant Medical Center who are subsequently discharged within 48 hours without receiving any surgeries or any admission to an ICU. So the central question is, what is the significance of secondary triage and why do we care? Well, secondary triage transfers patients away from their families and homes, unnecessarily causing emotional burden. Additionally, this may increase medical costs for families while subsequently stretching already limited resources and staffing. Therefore, the main aim of our study was to compare the rate of overtriage before and during the pandemic. So again, this just shows the three pillars that we use to define secondary overtriage in our study. Again, what is the significance of secondary overtriage? And our two primary aims on the study were to identify the secondary overtriage rate in the pre-pandemic group and intra-pandemic group, as well as look at the disposition from the ED. Further, we also looked at consults and procedures within the pre-pandemic and the intra-pandemic groups to identify if there were any variances between the two. This is an IRB-approved 3-year retrospective study, and we defined March 18th, 2020 as the inflection point for the beginning of the pandemic due to a statewide emergency issued by our governor. This provided both the pre-pandemic and intra-pandemic groups 15 months of data to analyze. We also collected additional data on demographics, subspecialties consulted, number of CT scans, transfer days, and treatments received. Listed are our inclusion criteria, and for purposes of statistical analysis, we used a p-value of 0.05. So for the results of our study, 6,774 patients were transferred during the period, and of those, 1,974 met our secondary triage definition. And then for the two groups, 29.7% of them were overtriaged in the pre-pandemic group, and 28.7% of them were overtriaged in the intra-pandemic group. And so we found that there was no significant difference between the secondary triage rates between the two groups. When looking at the demographics between the two groups, I want to call attention to the average transfer distance, as this further emphasizes an earlier point about emotional burden. We can see that on average, patients are transferred about 46 miles. Furthermore, looking at insurance status, we can see there was no significant difference between the two groups and that commercially insured patients were the most commonly transferred patients. Looking at the disposition from the ED, most of our patients were admitted to the intermediate or step-down floors of the hospital, and this most likely reflects a redistribution of admission locations given strains of the pandemic over the whole hospital, and not necessarily a reflection of the severity of the injury to the patient. Looking at subspecialties consulted in both groups, neurosurgery and speech-language pathology were the most common. Regarding procedures performed, laceration repairs and cognitive evaluations were the most common in both groups. When we look at the imaging obtained prior to and after transfer, there was a slight decrease in the amount of imaging obtained in both groups. Lastly, unsurprisingly, when looking at the day of the week of transfer, Saturday and Sunday were the most common days for transfer. The COVID-19 pandemic and insurance status did not affect the secondary triage rates at Grant Medical Center. The hopes are that the results of the study may serve as a basis for the development of new guidelines to aid decision-making process for transferring trauma patients. This also brings in telemedicine and further education to the sending facilities as additional adjuncts that could be implemented to lower the overall rates of secondary triage. On the other hand, we want to commend the care that was provided by the referring facilities during a time of significant stress. Lastly, some limitations to note about the study are the retrospective nature, limited applicability to other centers since it was a single center study, and lack of information regarding available subspecialties from referring facilities. Listed here are the references for the study. I hope you enjoyed, and thank you for listening.